Getting to know the team is an important part of the process when you're starting fertility treatments. Today I'm chatting with Yvonne Hinkle. She is a licensed vocational nurse with Dr. Bradford Kolb's team at HRC Pasadena, and we're talking about the compassionate and dedicated staff members that help patients on their journey to become parents every day. It's so good to see you, Yvonne.
You too, Julie.
So let's start by talking a little bit about what the team that you work with every day is like.
I have to say, I work with a wonderful group of people. They are all very pleasant, and we all work together to reach a common goal, and that is to achieve pregnancy for our intended parents.
Yvonne, can you walk us through what a typical first-time consultation would be like for a patient with Dr. Kolb?
Yes. So the first consultation would take about 2 to 3 hours with Dr. Kolb. Initially, you would walk in and sign into the front desk, and they will take you into Dr. Kolb's office. Dr. Kolb will sit down and review your history and any medical records that you wish to bring to your appointment with him. On that consultation, he'll also give you information on the process of IVF and what that entails and what to expect during your treatment.
So Yvonne, as an LVN with the team, what's your role with the patients?
My role would be to help facilitate necessary screenings in order to proceed with an IVF cycle. So if Dr. Kolb requests that labs are needed, uterine evaluation, which is a hysteroscopy, or any type of procedure that is required prior to the process, I would help the patient schedule those screenings and proceed with the protocol.
And you also have a nurse practitioner or a physician extender on your team, right? And
Yep.
She works closely with Dr. Kolb?
Yes, she does. Her name is Caddy, and Caddy is a very valuable member because she helps Dr. Kolb in a way that Dr. Kolb, she is an extra set of eyes for Dr. Kolb. She helps review medical records. She helps Dr. Kolb with ultrasounds and just with the overall process of proceeding with your IVF cycle.
Yvonne, I'm sure it's different for every patient, but what screenings might someone expect that they could need to have while they were undergoing fertility treatments?
The screenings that are required would be the infectious disease screenings. Those screenings are mandated by law. We do screen every patient that is coming in for an IVF cycle. Those screenings are blood tests that include HIV, hepatitis, and other sexually transmitted diseases that are required to be screened prior to an IVF cycle. Also, the female will need a hysteroscopy, which is a uterine evaluation, just to make sure that once Dr. Kolb transfers an embryo, that the embryo has a really good chance of sticking to the uterine lining. The male will also undergo some testing, which is semen analysis, to make sure that there is a sufficient amount of sperm that will help fertilize the eggs.
If patients need to take any medication or have any injections during the process, do the nurses train them on exactly what to do so that they can go home feeling comfortable with this?
Absolutely. We do take the time to sit down and review the medications with each patient. We send out written instructions, and also we give you visual instructions when you come in. So we'll go over how to mix and administer those injections before you leave and even before you start an IVF cycle.
How long does the process typically take from when someone starts fertility treatments to when they would sort of move on to start seeing their OBGYN?
The process I always say that the patient is in the driver's seat. So it can be as quickly as 3 weeks because we have to go through the screenings, or as long as it takes for the patient to be ready, physically and mentally. So a normal IVF cycle would typically take about a month to complete. So that would be 2 weeks of stimulation and then 1 week of post-stimulation through transfer.
For someone watching today who hasn't had the pleasure of meeting your team yet, tell everyone what makes Dr. Kolb's team so special.
That's a really great question. I've been with Dr. Kolb for almost 5 years now, and it has been just a pleasure to be a part of his team. Dr. Kolb is a very caring and genuine person. He's always available to his patients, no matter what time of day. He's the same way with his team. He's available to us when we have questions for our patients. And he's just a very nice, genuine person, and it's always a pleasure to be around him.
Sounds like such a great team to work with, Yvonne, and it was really great speaking with you today. Such a pleasure hearing all about the staff at HRC Pasadena, as well as Dr. Kolb's initial consultation. So I appreciate you taking the time out of your busy day.
Thank you, Julie. My pleasure.
And for those who would like to know more about fertility treatments at HRC Pasadena, please visit the website at hrcpasadena.com. Thanks for watching, everybody.